Now, from the News Channel 5 network, this is Medical Mondays.
And welcome to Medical Mondays. I'm Jessica Ralston, and we've got a great topic here tonight, one that always gets the phone lines very busy ringing. So make sure you call in to 737 Plus with your questions for Dr. Yalamelli from the Nashville Pain Center. 737 Plus. Every time you hear the phones ring off the hook, a lot of people have questions about pain, how to deal with it, pain management, and you have a lot of answers.
Thank you. Nice to be here again.
Yes, great to have you here. So if you have questions for the doctor, 737 Plus, give us a call here, and we will try to send some help your way. So to kick things off, though, I guess we can talk about maybe some of the advances in pain management.
Yes, there are, these days, we're not just depending on regular procedures and medication management, physical therapy, and of course surgeries. There are certain other things we do. These have been actually around for some time, but still it is a novelty for some patients. They've never heard of these things before. Like, for example, if they have severe back pain with shooting pains down the legs, or if they have severe neuropathy pain in the legs, in the feet from diabetes or something like that, we have something called spinal cord stimulation, which, in which we place stimulating electrodes in the spine, in the epidural space, and we stimulate the spinal cord in such a way that the brain only perceives the stimulation in the form of vibrations, and the pain impulses that are coming from the feet or the back are actually suppressed. So the patient gets about 50 to 75% relief when the device is turned on. It's an implant. It's like a pacemaker for the heart. It's pacemaker for this spinal cord. So the patients get very good relief from this without using medications. It is just an electrical impulse. It is suppressing the pain signals. So typically we have these patients go through some simple medications and simple procedures first, and if those modalities do not help, and if the patient is still complaining of a lot of pain, then we do offer this procedure for patients. And typically we have these patients go through psychological evaluation to make sure that they don't have severe anxiety or depression. And if they're cleared by the psychologist saying that, okay, this person understands the functioning of this device and he's a good candidate or she's a good candidate, then we do a trial in which we place a couple of electrodes in the spine and send the patient home for a few days, maybe up to a week, with an external battery doing the same work as an implant would do.
Wow. And
then they try it out and they move around, they try to turn it on, turn it off, try to use different settings, make it stronger, weaker, and see if it really takes the pain away. And at the end of the trial, we remove the leads and we discuss, and if they really get good pain relief and if they're able to sleep better at night with this on, and if it improves their sleep, if it decreases their use of medications and improves their functionality, then we decide to actually go ahead with the permanent implantation of this device. And this is normally done in the hospital setting. It's a same-day surgery. The patient comes in the morning and or a couple of hours before the surgery and goes home a couple of hours after the surgery. And the entire device is implanted under the skin. There is nothing outside. And the patient will have a remote control with which he or she would be able to adjust the settings, turn it on or off, and use it as needed. So it's one of the advances, I should say. I mean, it's been around for some time, or maybe about 10, 15, 20 years, but not very commonly used. It's done by only certain specialists, and of course neurosurgeons and orthopedic surgeons, spine surgeons do implant these devices. If the trial is done by the anesthesiologist or the pain specialist, and the implant is done by the surgeons. And then the patient needs to be followed up on a regular basis after this is done.
All right.
So the other thing is to deliver medications directly to the spine. That's called the intrathecal pump, wherein let's say the patient is on high doses of opioids.
And we've had people call in about that before.
Right, yes, and if they are not tolerating these medications well, or if they are still not getting good relief, These medications, instead of being taken by mouth, they can be actually put inside a reservoir, which is implanted in the abdomen, in the abdominal wall, and just under the skin. And this device is connected to the spine through a catheter. And the device is a very sophisticated device, and it can be programmed to pump the medication into the spine on a continuous basis, 24/7. It doesn't go in it doesn't like inject once in a day or twice a day or something. It just runs throughout the day, 24/7, and slowly pushes the medication into the spine. And by using about 100 to 200 times less medications than what they are on by mouth, we can get better relief. So if, let's say, if they are getting 100 milligrams or 100 milligrams of morphine by mouth, we can get the same relief or even a better relief by just infusing 1 milligram in a day through the pump. And these devices are so sophisticated that they can infuse like half a cc of a liquid into the spine uniformly over 24 hours.
Wow.
So,
but now how long could someone have the pump?
The pump, once it is implanted, will stay with the patient forever. It needs to be replaced maybe once in 7 to 8 years when it runs out of battery. Maybe earliest I've seen is about 5 to 6 years. It lasts quite a long time. And replacing the battery, replacing the reservoir is a very simple surgery. It takes about 30 minutes to 45 minutes. And it needs to be filled, though, with the medication every 3 to 4 months. And it's a very good device, and we have lots of patients who are really doing very well on these pumps without having to take the medications every so many hours on a regular basis.
Because a lot of people really just don't want to do that or want to deal with it. You know, we talk a lot about medications with you, and we've had people call and say that they don't want to have their medications reduced, but you say,
yes,
in fact, giving higher doses a lot of times it could be more harmful.
More harmful. And nowadays the research is very clear. The evidence is very clear on narcotics, opioids, in other words. They have not been we have not been very successful in treating chronic pain with high-dose narcotics. There are too many problems associated with this, like dependence, addiction, accidental overdose, and death. These are problems that do happen with high doses of narcotics. And as we have discussed before, these narcotics can actually worsen pain at very high doses. So decreasing the doses to lower levels can help a lot of these patients. But there are certain patients who do not do well on lower doses. They do need higher doses. But it's too risky to give them by mouth, or sometimes they don't tolerate it, too many side effects, or they're just not compliant enough to take it on a regular basis. It's too much of work, and their lifestyles may not allow it. There are so many different reasons why pump implantation becomes a good option in such patients.
Okay. All right. We have our first caller of the night, John. Hi there, John. What's your question or your comment?
Yes, I've had chronic pain for a while now, and the medications tend to just make me sick, and I'm wondering if there's any treatment options besides medications for pain, back pain, and neck pain.
Yes, John, thank you for calling. And yes, there are multiple options we have in chronic pain management, which we use for patients who cannot tolerate medications. So it all depends on what kind of medications you have tried so far, whether they were regular non-opioid medications or opioid medications. There are different kinds of medications we use for pain. There are medications that work on the nerves, medications that work on the muscles to relax the muscles. There are medications which work on inflammation in the joints and various structures of the body. So if these medications are not helpful, we do use antidepressants. We do use, finally, if none of these help, we do use opioids. And there are topical creams that we use with the similar medications compounded into it. And these creams also can be very helpful. If none of these options are good for you, then there are other ways to treat the pain too. There are, like, we can send you for physical therapy on a regular basis, like once a year, maybe for a few months, 2 or 3 months once a year. Then you follow it up with at home with a home-based exercise program. And of course, if these don't help, then we have injection procedures where we use sometimes steroids, sometimes we use just radio frequency energy to ablate, silence some nerves that are causing a lot of pain, to silence some joints that are causing pain. So it all depends on where the pain is coming from and what you can tolerate, what you cannot tolerate. And some of the advances that I was just explaining, if you have pain in the back or neck, shooting down your arms or legs, and those are not under control with all these medications, then as we were discussing earlier, we can use spinal cord stimulation. So there are multiple options available nowadays for pain management other than just medications.
All right, great. Well, we're going to take a quick break, and when we come back, we're going to take more of your calls. So give us a call here at 737+, and you can talk with the doctor about any issues you have with pain or pain management. You've got some calls coming in now, so we'll get to those right after this quick break.